like to welcome our distinguished panelist, Rear Admiral Susan Orsega, our MC Captain Antoinette Jones, our Beacon Program Committee, and all our guests. As the Clinical Director of NINDS, I'm absolutely delighted to welcome you to our first of many career forums of NIH nurses. We've always had a strong program to support the neuroscience nurses at the clinical center, as well as the intramural program. However, this is very different, and it's focused on career development. About a year ago, I had a discussion with Maureen Gormley and Joan Ohan, who have done an outstanding job thinking through how career development can occur within the intramural program, because the infrastructure poses unique challenges. And they've done a superb job putting this Beacon program together. And we're absolutely delighted to have the opportunity to support these very hardworking nurses who provide not only help with the clinical research program, but also provide outstanding care for our patients. They're very dedicated, caring, and they provide an incredible array of services. So this Beacon program really is for career development and to bring a sense of community amongst the nurses and nurse practitioners. It is really an acronym, and it stands for Building Engagement and Community for Nurses. It offers a career forum, and in the form of career development, coaching, mentoring, training, onboarding programs, stay and exit interviews. It also puts a spotlight on our nurses who really are as the word says, they are really the beacon of the program itself. And so I'm absolutely delighted and pleased to extend a special welcome to many of the nursing colleagues from across NIH who are attending the program today. And now I'm going to turn it over to Joan Ohan, who is a nurse practitioner in NINDS and a senior nurse consultant, who will introduce our speakers.
Thank you, Dr. Knapp. Welcome to our inaugural Beacon Career Forum. This is the first of many forums we will host for NIH nurses to highlight diverse nursing career paths, contemporary practice models, and professional topics of interest. We are pleased to host a diverse audience today, most of whom are from across NIH. It is my absolute pleasure to introduce our distinguished guest, Rear Admiral Susan Orsega. Rear Admiral Orsega's career spans over 32 years in the United States Public Health Service. Commissioned in 1989, she was assigned to the NIH when the HIV/AIDS epidemic was unfolding. Later, she was responsible for the operational management of NIAID projects with South African and Malian governments, involving international healthcare professionals that provided research opportunities to participants in both countries who would otherwise not receive treatment. In 2015, Orsega was appointed to the NIH-NIAID Ebola Trial Operations Team, which ensured the first human vaccine and treatment Ebola trials in Liberia and Sierra Leone. She has a distinguished public health experience ranging from selection to an elite United States Public Health Service medical team after 9/11, as well as 17 other national and international disaster humanitarian deployments, serving in progressive nursing and leadership assignments since 1995. Rear Admiral Orsega has also served as Acting Surgeon General, United States Public Health Service Chief Nurse Officer Surgeon General, Director of Commission Corps Headquarters, which included her managing the activation of the largest deployment of United States Public Health Service Commission Corps in support of international and national COVID-19 efforts. In her current role, she serves as the Senior Advisor to Assistant Secretary for Health and Surgeon General on a full range of programs, policies, and activities, and a heavy focus on core modernization in response to public health crises. She is a subject matter expert in the realm of HIV/AIDS nursing experience, international operations, health diplomacy, and disaster response, has co-authored 25 articles in peer-reviewed journals, and presented at 40 major scientific and nursing conferences around the world. Rear Admiral Orsega earned her Bachelor of Science in Nursing from Towson University and a Master of Science from the USU Graduate School of Nursing Nurse Practitioner Program. She is a fellow in the American Association of Nurse Practitioners and an American Academy of Nursing, and the recipient of numerous distinguished awards over her career. We are honored to have her with us here today. I would also like to welcome and thank our moderator for today's forum, CAPT Antoinette Jones, who I think is known by many. CAPT Jones began her federal career in 1987 as a graduate nurse working in the field of oncology for the National Cancer Institute. She later joined the Clinical Center Nursing Department, providing nursing care to patients in both inpatient and outpatient oncology settings before moving into the role as a nurse in NCI. She returned to the Clinical Center as nurse manager from 1999 to 2007 of inpatient, outpatient, and day hospital environments. In 2007, she joined the Clinical Center Office of Workforce Management and Development, where she applied organization development strategies to enhance the development and productivity of staff at every level. CAPT Jones served as the operations manager for the Department of Radiology and Imaging Sciences from 2013 to 2015. In June 2015, CAPT Jones became the Clinical Center patient representative, a role in which she partners with NIH staff to ensure the optimal patient experience. She's been an officer in the United States Public Health Service Commission Corps since 2005. We are grateful to have her tremendous energy and authentic presence today as we welcome CAPT Jones as facilitator of our event. For the next 30 minutes or so, CAPT Jones will interview Rear Admiral Orsega on the many facets of her long and impactful career as a nurse. We invite you to make any comments along the way in the chat, and we have a question and answer box open for you to input any questions you have for our guests. At the conclusion of the interview, we will invite Rear Admiral Orsega to address as many of your questions as time permits. And now I will turn the program over to Captain Tony Jones. Thank you.
Good morning, everyone. Thank you so much for joining us. I want to give you a welcome, as so many others have already done. And I just want to tell you that you are in preparation to hear something very enlightening, something very exciting, something very informative. And we are just excited to have this conversation with Rear Admiral Susan Orsega. She's one of our own, so we're all quite thrilled to have the opportunity to hear from her. Rear Admiral, I will tell you that the number of people that have stopped me in the hall or sent me an email just to tell me how excited they are about you being here and how lucky I am to be the one to actually ask these questions is numerous. And they're right. We're very thrilled. We feel like your family, and we're so delighted and so proud to be nurses and to know you and to have you here with us today. So I have a pen, and I'm holding this up to tell all the participants to grab a pen, because you will hear a tip today. You will hear a nugget of information or an insight that you may be able to use as you leave this conversation. I have mine, and I hope that you have yours, because you're really in for a treat. So less of me, more of Susan. Here we go. Rear Admiral Orsega, you have had such a long and impressive career. Let's start this conversation with telling us how you began. What influenced your decision to become a nurse? And tell us a bit about the academic and professional path that you've taken.
Well, first of all, thank you very much, Captain Jones. And as I said previously, I just do want to extend my deepest appreciation to NINDS, the director and the clinical director, and really all of you who put this together, my colleagues, Maureen and Joan and others. I'm going to make that comment. I purposely make that comment because as you hear me talk about my career, I'm going to point to collaborations. So, I think like all of us, you don't really start to ask that question, what your drive decision was to become a nurse, but it's what that affinity was. And for me, I came into the nursing profession because I had a real love of science. I had sort of attracted to science and that sense of really trying to understand and discover the puzzle behind why individuals were getting sick. Certainly that was, like many of us in nursing, we start to shape the determination to be a nurse in high school. And that led my career really to Towson. At the time, it was Towson State University. And I then saw a poster literally on the side of in the hall that said, join the United States Public Health Service and be able to have unprecedented opportunities to serve in the most underserved and vulnerable populations, and should be challenged to serve in your country. My top picks were at the time, so it was between, you have a COSTEP program, Commission Officer Student Externship Program, which I know many of you on the here today have participated in that program. And that's really to give you a peek inside what it's like to work as both a public health service officer and to work for the government and to make inroads into health. I chose, my top pick was actually the Indian Health Service. My second pick was the NIH. And I got the NIH. And so I was selected to work at the NIH during the summer, where individuals who we all know well, like the likes of Dr. Fauci, Dr. Robert Gallo, I was in those halls and really learning from them. And that was a pivotal point for me because it really cemented why I wanted to go into nursing. It wasn't until that period between junior and senior year where that affinity for science became really was really integrated into why and the drive of why I became a nurse. As I moved through my career, what I loved about the National Institutes of Health, and again, I had several. My senior year, I graduated, and I had again the same program, the senior COSTEP program. Again, I chose the Indian Health Service first choice, NIH the second choice. I got the NIH, but I feel for me today why that was so. Why I'm so grateful is because the NIH did a couple things. One, it gave me a forum to collaborate. One of the unique components of the National Institutes of Health is our ability to collaborate. I was actually just talking to Dr. Nath about this. Do not forget, one of the pearls of working at the National Institutes of Health is our ability to collaborate and have that seat at that table, to have a vested decision-making input along with the other colleagues from across other disciplines. That is very unusual to have that authentic and purposeful and meaningful collaboration. Many of our colleagues across institutions and entities outside in small community hospitals or even large hospitals that you can call to your mind, they still are challenged by that. But that was really I love that sort of intercollaboration pathway, walking the halls. That was one of the drivers why I wanted to go into becoming a nurse practitioner. I worked at the Clinic 8 and I loved that intercollaborative thinking. Thought it was sort of like a think tank, a thought tank around trying to make the right decisions alongside with the patients at the time around HIV. And so that drove my determination to get selected to go to the Uniformed Services University. I get questions a lot, and we're going to stick on this question a bit, Captain Jones, because I want to make sure I'm giving lots of points to many who are at different points of their career. I have had a lot of questions about why, how to frame, how to tell a supervisor your goal and how to get them to support you to something that's going to have a financial implication. So while the Uniformed Services University does not have a financial implication, it has a agency, the NIH, that specifically for me, NIAID, had to support me to be able to be taking time away. It was a business decision because I took and encumbered a slot, a position, and they supported me for 2.5 years to get training to become a nurse practitioner. Mm-hmm. And so the reason why I mention that is if you thinking about what I just said about that interprofessional collaboration, building partnerships, talking about shared experiences, and then having a shared vision. So it's how, and I will say, I'm not certain that any one of our professions do good job of trying to help people articulate what their vision is, but have a shared vision. So go into that discussion with your supervisor and say, I really think there's a gap in X, Y, and Z program. And by supporting me in blah, 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 I can really fulfill the goal of the Institute in advancing, in this case, advancing the care of around their program, around research portfolio to deal with infectious diseases and immunodeficiencies. And so build that vision into, and get your supervisors to really understand why it's a value add, do a value proposition essentially, rather than just going in and describing that goal. And that to me was a turnkey moment, because it gave me a skill to then also continue to take that stance and that ability to leverage my leadership and leverage my ability to critically communicate my goals to senior leaders, which I will have to say really allowed me to opened up doors along my career pathway, from being a chief nurse to also continuing to support the NIAID's program around international clinical research, because I love the complexities and the challenge, and I love the interprofessional collaborations, and then continuing to put my paperwork in to be selected for the Commission Corps Headquarters Director to where I am right now today. So that's just a little bit. I think we probably could go on and on about that, but just that's really how I got to where I am right now.
That's really helpful. I think that many can just sort of hear that idea of being able to communicate in a way that says, what can I get from me, but what can I do for the organization, and how those things come together. That's very powerful. And many folks don't do that in their careers. Thank you for that. So as a prominent leader, Susan, forgive me, Rear Admiral Susan Orsega, I want to say that, and certainly. What are the key challenges that you juggle currently? What's a typical day in the life for you?
Oh, great. That's a fantastic question. Thank you so much for asking. I will say that the trenches here, and this is downtown at the Humphrey Building, they really offer extraordinary effort and commitment, and really looking at where kind of appraising and taking an appraisal of where the department is going as it intersects with the major administration focuses. So, why I say that is again, my hope today is also give you a sense of, one, it's that purposeful focus that we have, but also a typical life, a typical day of my life is really somewhat unpredictable. And meaning right now we're in a budget cycle where it's responding back to the Office of the Management and Budget, those around respective budgets that have to deal with the Commission Corps. Secondly, very fortunate to have participated both in my past role and my current role, and guiding and advising around the budgetary forecast which is helping guide and prepare for the next round of submissions for budgets. I don't think, again, I'm going to point to nursing, but I'm also going to point to a broader, hoping that there are some others from other disciplines are on this meeting, on this interview today, that take some time, if you haven't, to really understand what role you play in budget development, budget execution, and to try to get some exposure around budget development, budget execution, budget formulation. I was very, again, fortunate to have in my role at the NIAID, working closely with the budget officers and helping craft and draft and develop an operational plan around the budget that was used for Mali, particularly that international collaboration. And that gave me a fundamental skill, a building, really a business acumen that allows me to see at the very high level the key. So really just though that, had I not had that preparation, that would have been a larger challenge. I'm actually, I like that challenge. So, but had I not had that, I wouldn't have been able to stand here today. But the reason why I mention that is it's really thinking across a strategic horizon, being in discussions that are at the department level and thinking second, third, fourth consequences, both from a budgetary standpoint and also modernizing the core. For those of you maybe on this this interview that have been hearing the Corps talk about modernization, and kind of sounds like, well, why are we worried about modernizing the Corps? The Commission Corps and the Secretary and the Surgeon General and the ASH all have to validate, advocate for the Commission Corps. And historically, over the past, I would say, two, maybe three administrations, and even back, I was told by Admiral Levine very recently, back in the 60s, the same challenge existed about modernizing, the need to modernize the Corps and to line up with our other services and to be similar, because there's a need for the Commission Corps, and we have to make sure that we're responding to these, quote, overseers, the people who hand out the money to support the Corps. And so one of the things that I'm also doing in normally during the day in terms of advising the Surgeon General and the ASH, I'm talking to them about all the things that are dealing with the modernization, all of the health equities that we're addressing, and then finally the Ready Reserve, which just to kind of blow the horn for those of you who are civilians and ever want to respond to a disaster, the Ready Reserve is just like a reservist program, and compared to other services, in that you get activated when your skill is needed. You come into the Commission Corps, the same appointment criteria, the age limitation, the all of the physical fitness requirements that we have to have, but you get activated, and it's really intended to be an extra, expand our scope, and another person, another individual to respond to the disasters. Our demand has been up probably now, having been a bit out of it since September, I would say still upwards to about 47% increase since 2013. So the demand for Commission Corps officers is higher than it was even last year at this time.
Great. Having a sound leadership philosophy is key to the success of any professional. We want to know what tenets, what beliefs, what principles guide you in your leadership as you take up your role, and how has that changed over the years?
Yeah, thank you very much for that. That's a really fantastic question, and I was glad to see that question because again, for me, I've used what I'll call, and there's a reference to this, you can Google search this, a hardiness resilience gauge, if you're familiar with that. Resilience requires a leader to be disciplined. And what the hardiness resilience gauge is, it's like three qualities. It's used in leadership, and I've used it because it allows me to frame the thinking to be more purposeful. So it's a gauge that really looks at qualities, challenge, control, and commitment. And challenge is really about taking that risk and putting yourself out there. So it was a challenge, right? When I said to, at the time, the National Institute of Allergy and Infectious Diseases, to share my vision. It was a challenge when I became the Commission Corps Director, and it was a challenge when I was selected as the acting Surgeon General. But it's sort of taking a risk and putting yourself out there. And control is the second one, and that's really your belief and your ability to influence outcomes. I'm going to come back to that in a second. It's really how you frame and how you contribute to working groups or decision matrix that happen across any organization. And then commitment is really about that purpose, that authentic leader believing what you're doing is really spending time on what matters most. And I think that sort of makes sense. Throughout my career, when I've sort of been in the trenches, I've realized that you have to have that resilience. There's another kind of reference I always use, and everyone, you all, as you kind of go through your career, you'll pick these principles that you realize guide you as a person, as a leader, in and out of your work life, and it guides your decision making too. And that one is VUCA. It's actually adopted from an Army principle. VUCA, VUCA, stands for V is for vulnerable, U is for uncertainty, C is for complex, and the A stands for adaptability. So you get working in through two administrations, working through the last administration, and then of course the handoff over to this administration. You have to really use the right kind of, and it's different for everyone, but that discernment of what is worth making a decision on, but that's really being aware, being adaptable, because every day wasn't the same. There was so many complexities. I often say it was sort of at times sort of working in like a 4D chess environment, and uncertainty and vulnerable. You can apply that VUCA. I applied that to when I worked internationally, and I applied that to when I worked when I was deployed. But those two principles of hardiness, resilience, gauge, in VUCA drive who I am and my approach as a leader, and my approach in addressing the pressures throughout my career, sort of being in the trenches.
Thank you. There are so many varied career pathways for nurses in today's expansive healthcare environment. How have you seen the role of the nurse change over the course of your career?
That is, thank you for that. I think for me, where I've seen the role, and my hope is that that we see more change across our profession. When I came in the role, so I think things. So Captain Jones, I think you and I were involved when we had the shared governance models, right? That we won't tell everybody when that was, but it was many years ago, and probably Maureen and Joan were involved in it too. But I think for me, I see things, look back to learn how you can look forward. And what I mean by that is, and the reason why I use that example is many of us came into the nursing profession when there was such a great need for nurses. There were workforce challenges. There were many nurses who were actually getting out of nursing. We're actually in the same challenge right now. We have, and I don't know what the average age at the National Institutes of Health is for nursing, but if I stop to look at where we are right now in the roles of the nurses, I think the role in the nursing when we came in was very kind of, in many ways, it was sort of, there were boxed approaches of what one could do. You had very specific career pathways. What's exciting now is you take nursing and use that as a launch pad. Take nursing and use it as a launch pad to then determine where you can make inroads. And so the diversity of the types of career paths, the non-traditional career paths, that aperture is so much wider than it was when I came into my career. in 1990 when I graduated. That is actually to our advantage. Do I think that nurses could do a better job of really thinking themselves in that capacity? Absolutely.
Mm-hmm.
And I'm going to expand a bit on that because if you all take, I'm probably going to answer number 6, then the next question, Captain Jones, but if you take a look at where every one of us has unique capabilities. And visually, if you can imagine, and this is just something that I came about as a result of, quite frankly, a failed a goal that I had that I didn't achieve. And it wasn't an insightful decision that I made at that point, but it was after a period of time where I had not achieved a goal that I wanted. It allowed me to actually kind of look at my career. And I realized if you think of a 3, almost like a Venn diagram. And so if you have one circle as being the opportunities, another circle as being those types of the passion that you have, and another circle as being what's your professional interest. 3 different. And if you can get to that middle of that Venn diagram, that's really what I call is your sweet spot. Your sweet spot is being most influential. Your sweet spot is being a leader. And all of us are different. And yes, it becomes the nursing role has got me into being where I am today. But more importantly, all of us have a very different passion. My professional interest is infectious diseases, nurse practitioner, and leading people. My passion is around being able to work in complex and challenging environments. That's what the affinity was to working at the NIH. My passion is also working with interprofessional collaborations. But everyone has a different passion. And then finally, those opportunities where you'll be afforded because people will recognize what your professional interests are and your passion, or you'll seek out opportunities based upon those 2 other circles. So, but don't shy away from being, a assistant secretary for health, although that's a political pointing position, but let's say a principal deputy assistant secretary for health of one of my colleagues who's now retired, Admiral Trent Adams, had. Or don't shy away from a position, let's say, as being a senior manager in a non-nursing traditional role. Don't shy away from those, but use those principles that I just talked about, because that's how those jobs are out there, and those jobs are, nursing is very well equipped to be in those roles. We just need to see ourselves in that way.
Thank you. Are there any other concrete steps that you took when you decided to take on a new role at any point in your career?
Actually, I'm one of those individuals that does set goals out, which I know is very certain. Not everybody does that, depending on your age, chronological age. But I think it's being aware, even if you don't set, I did set out goals to be a nurse practitioner. I was looking for a role with a greater span of leadership and an ability to have a greater responsibility in terms of managing. And so with that, those were the indicators that, and just to challenge myself. And that's one of those things that I like to do. And so that's how I got that. That's what I did essentially in terms of exploring changes in my professional career.
Great. Rear Admiral, as nurses, we often are aware that all voices are not equal in the hierarchy of healthcare. You obviously have an important voice and a platform. Can you talk about strategies you have used to overcome barriers and speak truth to power? How has this capacity evolved over time?
Right. So I'm going to answer like two parts of that. I think one is all voices don't have the same equity in healthcare in terms of both. If I just look at patients and then who's delivering the care, I want to just speak to patients for a quick moment. There's a lot of data now, and more data is suggestive of that changing health care, changing actually the patient's ability to adopt treatment regimens or take on preventative mechanisms, preventative care, that the data suggests that if the individual doesn't look, who's speaking the need to have a healthcare change, doesn't look, act, or talk like that person, it's more difficult to get that change. So I just say that, recognizing that as we all are delivering healthcare across inpatient, outpatient, or even talking about preventative medicine, or sitting at the state table where you're looking at contributing to and have an eye on that diversity. Certainly some of you sit at tables where you're looking at sort of the statistics of screening enrollment. But make sure we know that all those voices at the end of the day really do matter. There's a lot of HHS certainly is looking at health equity across and sort of COVID with the backdrop is driving that. But I just wanted to acknowledge that. The second part, which I think is more of what you're asking, is how do we as nurses see ourselves as, change and being catalysts. And if you look at nursing just sort of as a chemical, right, a chemical catalyst, they're sort of behind the scenes, but they're making an impact in chemically because they don't exert that much energy. And I think nursing, we have to figure out how our role can be not about pushing harder, but being deliberate about our energy. And so it's about removing those barriers and looking at, so if you're at a table, a decision-making table, it's thinking of what your contributions are as a profession, as a data point to the discussion, and looking at factors that you think you can help mitigate, not just by what nursing can provide as a solution, but what you as a thought leader, you as a person, back to that sweet spot comment, your contributions and how they are playing a role to be able to make a contribution to that decision. Look at nursing as a business, is my other last point. And in other words, bringing that data and what the profession can bring, what you're seeing. If you think you could save X by doing Y and Z with the clinical trial, think about it like that, or express it in that view. Oftentimes I think our profession go in and just want to have a seat at the table, but recognize that those around us that are inviting the profession are inviting them because they're looking for what's not only what our presence is at the table, but actually the intellect that you bring and can contribute to the discussion.
That's awesome. Thank you for that. I think that's one of the struggles that many nurses have. How do you do that and still be in collaboration with versus an adversary of? And so those are really important pieces that you bring up. So this is the point in the conversation where I have to offer others an opportunity to ask questions, even though I could go on. So let me just allow that to happen. And I have folks helping me monitor the chat and monitor to the questions. Maureen, did you have a question to bring forward for Rear Admiral Orsega?
Good morning, Rear Admiral. The question has to do with career burnout. it appears from your own career that your growth has meant pursuing new opportunities at various junctures. What advice would you give to nurses about indications that it's time to grow, time to change, either pursue a new position, a new opportunity, new education, or new responsibilities, in order to keep it fresh?
Thank you, Maureen. Great question. And at a time right now where COVID is really challenging many across all professions, really, and even all different sectors, and the reasons why we're sitting in these spaces and places. And maybe even arguably driving people to take on be new adopters of different things that maybe they've wanted to do that they've never done in their life. I would say for what I would offer is just, look at, two things. One, communicate to your supervisor that you want to be challenged, that you're looking for something. I will personally and professionally tell all of you that the NIH offers a tremendous amount of professional growth opportunities that are not always present in other agencies. But that first step is you've got to communicate with your supervisor and say, I'm looking for a different challenge, or I need to be challenged, because that might offer a dialogue of thinking through things, clinical trials, programs that are on the horizon that they may look to you as helping develop. And then the second part is keep your eyes wide open. So not only communicate with your supervisor, but leverage, have one or two or three influencers, mentors, and don't just have a mentor in nursing. I will kind of keep all parties anonymous, but I have a lot of mentors at the NIH who are not nurses. So get a different perspective from a different profession. And then, finally, be tactical about it. So that's sort of the strategic and the operational, but then be tactical about it and take some time to do that appraisal of what you've accomplished. And then you can see, well, I really want to be deliberate in expanding and developing my budget knowledge, because of that tactical approach will then further help you communicate to all of those who want to coach. You're looking for coach to that next progression step.
Great.
Very nice.
So my next question for you is, you've had many deployments over your time, and I want to ask you to pick a favorite, but what was a deployment where you felt that you were stretched in a way that you never forgot? And there's some key lessons from that you carry with you still today.
Yeah, thank you. That's a really, thank you for whoever asked that question. I will tell you, all the times I was deployed, I was stretched. But the biggest, I'll say the one that was most complex was actually one that was in Katrina. And I want to sort of do it from two angles. One, that the reason why I was stretched was because it had to do with sort of life or death, right? Getting resources to that center that needed oxygen tanks. And so it stretched by meaning I went through that normal route that we all do, right? And, in the hospital, like you low on supply, you put a requisite, you get that whatever you're asking for, you get it. In this one, I had put in a call, and we were getting a request up through downtown, through Humphrey, but it wasn't coming. There were no oxygen. We were running low on oxygen tanks, and another storm, Hurricane Rita, was coming in. And so I was gravely concerned about the health and well-being of both the individuals who were running low on oxygen and those who may come into the door because of the need to open up the doors up. So what I will say is whatever tool you have, whatever way that you can stop and kind of reflect, do that, because in the moment of this chaos, sometimes it's difficult to think creatively, but it's those creative decisions that will help you in the long run. So for me, what I ended up doing is sort of stepped outside and was kind of talking to someone about it. And they said, well, did you think through about maybe seeing if the local fire departments could help you? And, that's like, probably all of you say, well, that's simple. You should have thought of that in the first place. But the state and the local jurisdictions were so focused on the disaster that those types of continued conversations around something as simple as oxygen tanks we weren't talking to each other. So think creatively, but that was by far one of the most stretched. And then as a leader, and I'll just close on this point, but as a leader, stretched then certainly would have been at the time when the pressure was in January, when I was appointed as acting Surgeon General and trying to figure out how we were going to get officers deployed. And that was really the beginning of where we are right now, with just the constant kind of battle fatigue that everyone's having in terms of deployment. And that was the beginning of that stretch then as a leader.
The last question we'll ask you before I turn it back over is, if the participants that are listening today walk away from this conversation, what are one or two pieces that you want them to remember if they remember nothing else?
Yeah,
what you share?
Thank you. Know that, two things. One is that Venn diagram that I talked about, that will take you far. The opportunities, the professional discipline, and the passion, because each of us are unique. And I think we only look at ourselves, whether it be a physician, a nurse, a PA, a respiratory therapist. We only look at ourselves as a profession, but we don't think about what our strengths are. That's sort of our 3D dimension of who we are as a person and as a leader, because we're all leaders in our own right. And I think the other part is how interconnected we are, how interconnected you are at the NIH, and that to work across the profession to address in the way that you're addressing COVID, the success that you all have had, to recognize the importance of pivoting to address future public health crises. Because my hope is that what COVID has taught us as public health leaders to break down those barriers and to work more collectively to solve the burdens of public health, because I'm really, truly optimistic about our nation, and know that once we get on the other side of the pandemic, but getting on the other side is the challenge, making it stronger. But to recognize that all of us have a role to play. We all are catalysts. We all have to see ourselves as catalysts and be champions for change.
Thank you so much, Rear Admiral Susan Orsega. It's been a complete honor to be able to do this with you. I know that all our participants have learned so much. I have a page full of notes myself, and I'm going to walk away with these tips that helped me in my own leadership as I go forward, because we're never at the end of our game when it comes to growing and learning and developing. So again, I thank you so much. And now I turn it over to Dr. Horschitz.
Well, yeah, thanks so much. I really appreciate the chance to talk to you briefly, and appreciated what we just heard about how each of us has opportunities to contribute to the greater good, but those opportunities change, and they change, kind of unpredictably. But if you're prepared and you're interested, and you're in the medical field as a nurse, I think that what Dr. Orsega told us is that there's just so many ways you can go over your career, and that I think is important. That trying to do new things, it's always on your plate. Then opportunities will arise, and you just don't know where you'll end up. You could end up as an admiral. And for me, so I think that as a director of NINDS, and must say I ran a neurointensive care unit, so I worked with a team of nurses that were, we were just tied at the hips, because we were all kind of fighting to keep people alive. And at NINDS, personally, I think I'm in the same boat. We're trying to keep people brains alive, trying to keep people from disability due to neurologic diseases. And, it's the ideas that count. It's not, what your profession is. It's the disease. It's the ideas that count. So we're always open for folks to kind of help the mission of the Institute. And the nurses have really special experience that certainly, I haven't, taken care of a patient 15 years. And so the nurses who are, in the trenches with the patients they know what's really important. And so many other things that they can offer that we are looking forward at NINDS to encourage greater and greater contributions. So just want to thank folks who put this on, and Maureen Gormley for continuing work to improve the career development of our nurses. And I'd like to turn it over to Dr. Shannon Zenk, who's the director of the Nursing Institute.
Thank you, Walter. Good morning, everyone. It's such a pleasure to attend the forum today. I really want to commend my colleagues at NINDS for launching the Beacon program, because we do know that building engagement and community for nurses is vital to the research missions of NIH. And certainly Rear Admiral Orsega's career path, the challenges she's faced, and her creativity and leadership are an inspiration to all of us in nursing. An important part of our work as nurse leaders is to create healthy work environments in which all of our staff are encouraged to engage in partnerships with other professionals. And we have tremendous power to transform healthcare and people's health through our practice, our teaching, policy, and research. So I am so excited to be part of today's event, where Admiral Orsega, our esteemed colleague, embodies all the qualities it takes for nurses to contribute fully. And she really knows how to collaborate, as evidenced by her career path and by today's discussion, to really cross boundaries and get results. So I am so excited to see all the nurses here today filling a diverse array of roles at NIH in support of our vital missions and improving global health. And as we continue to take on important roles, please take note of the ingenuity, the creativity, the originality with which Rear Admiral Orsega practices nursing, and let her career path inspire your own. So thank you so much for all you do, and thank you, Walter.
All right.
Okay, so going to take this last opportunity to make some closing remarks. First of all, I also wanted to thank Rear Admiral Orsega and Captain Jones for a very stimulating discussion. I really enjoyed it and learned a lot from it. Also want to thank Maureen Gormley and Joan O'Han, whose untiring efforts have made this possible today. And also want to thank Dr. Korshas and Dr. Zenk for their strong support for this program. And this is another example of the strong relationship that we built over the years between our two institutes. And I look forward to further interactions with each other. And I want to thank all the participants and each of the members of the audience here. And we look forward to further discussions like that. Thank you.